We were using another brand of hysteroscope, but the problem was you couldn't operate with it. You could just look, and then you had to take out the scopes. So the difference with the LiNA is that you can operate while you're still looking at the lining of the uterus. The other reason that we switched was the optics on the other scope were not as good as the LiNA scope.
I would add to that the fluid management system. The other device, it was a little bit tricky to keep the endometrial cavity
Distended.
So with the LiNA, it was definitely, we just kept a good distension visualization, and we didn't have to troubleshoot a lot, which was also very beneficial for us to just have a smooth procedure throughout. So for the main thing is, I would say, abnormal uterine bleeding or postmenopausal bleeding. I've been also using it for lost IUD threads. So these are, because of the operative scope, we can definitely be able to achieve all of these conditions like the same day. Do you have anything to add?
No, I agree. That's what I use it for. Yeah. But now when somebody comes to our practice for postmenopausal bleeding, we almost always do a LiNA because we can see what we're biopsying. So doing an endometrial biopsy, you can't see, you may miss things, you can't take care of the problem, can't remove a polyp. So when we can see it, we can remove it. And it really saves the patient multiple procedures.
And most importantly, like missing pre-cancer or cancer, if we're able to see the spot that looks suspicious, instead of just going and doing a blind biopsy, we can actually go in and see which area looks a little bit more suspicious, so we can biopsy it.
Right.
I would say that any provider that can operate a hysteroscopy honestly will be able to operate the LiNA scope.
Right.
It was very user-friendly. It has like few clicks on it, so we don't like a fluid management or even the camera. So it was very easy to use for any provider that can just do basic hysteroscopy as well.
I also like that it's disposable, so that we don't have to worry about sterilizing equipment or cleaning everything off, especially in this era of COVID.
The nice thing about the LiNA is that the operative port, it has a couple of instruments that we can use to retrieve in the IUD strings, or even to retrieve the polyp or to get a biopsy. And all of that, in the past we used to go to the hospital to do that, and now we can just do it in the office as quickly as 10 minutes.
We love the LiNA. Yes. It's really changed our practice. Yes. We're making more money. Yes. We're staying out of the hospital more, so we don't have to block time to go to the hospital to go do these procedures. And the company has always been very supportive. Any questions, any problems, it just takes a phone call.
Definitely it has changed my practice. Honestly, I can't imagine how many patients in the past we really had to go to the hospital for minor things, and the actual procedure at the hospital would take maybe 10 minutes, but the preparation would be days to hours. So I think it definitely is the future of medicine and gynecology.